Hello folks, this is Yvette LeBoy, Lupus Wellness Coach and Health Coach. Happy Valentine's Day to everyone. I cannot let this day go by without speaking about lupus and the heart because I always talk about lupus and the heart around this time of year. 2020 was, and now 2021 was all about the coronavirus, COVID-19. But the numbers and the deaths, the annual death due to COVID, by far surpass the number of deaths. Actually, no. What I meant to say is that the heart attack numbers, in comparison to the COVID numbers, are way more higher than COVID. At least 10 times the amount. And according to American Heart Association, coronary artery disease is the leading global cause of death and accounted for approximately 18.6 million deaths in 2019. So recent studies show that 22% of the population has gained what is called Hola Prima, Quarantine 15. That's the extra weight put on during lockdown. And weight gain is just one of the factors that increase our risk of coronary artery disease. So today's topic is going to be about lupus and the heart. One thing I want to share is that the body has its own innate ability to heal if you give it what it needs. So get in tune with your body and it will give you clues as to what it needs to nourish and heal itself on every level. So I want to pour some knowledge that I have acquired that has helped me maintain my healthy body into you today. So get comfortable, stay for a while, and hang out with me and get a glass of water or tea. Today's topic is lupus and the heart. So I'm not going to keep you guys for too long, and I'll be putting this on my YouTube page once I'm done. So if you suffer from lupus, you are at 50% risk of developing coronary artery disease. Patients with systemic lupus erythematosus have a significantly increased risk of cardiovascular due to atherosclerosis. Now, this is what happened to me. I had 2 heart attacks due to lupus. One back in 2003 and one in 2018. And it took a long time for it to happen again. The second one had a lot of emotional things attached to it, and I'm going to talk about that later as well, the emotions and the heart. But anyway, evidence strongly suggests that atherosclerosis plaque is largely driven by the inflammation and an active immunological response. So premature atherosclerosis is a major co-occurring condition in patients who have lupus. So coronary artery disease. Hey Jeff, how are you? Hey Pedro, how are you, sweetie? Or atherosclerosis is hardening of the arteries. It is the #1 killer of both men and women, whether you have an autoimmune condition or not. It is the #1 killer in this country. It rates higher than cancer. You see I'm wearing my hearts today and my heart in the back. So it's basically hardening of the arteries and is the #1 killer of both men and women in Western countries, whether they have lupus or not. It kills more people than cancer and COVID. Every 30 minutes, 20 people will die of cardiovascular disease. So what are the top contributors to heart disease, whether you have lupus or not? Inflammation, smoking. I can't believe that in this day and age people are still smoking, but it does really raise your risk for coronary artery disease. Infections such as viruses, bacterial, parasites, high blood pressure, poor immunity like an autoimmune disease like lupus, thyroid disease is also considered an autoimmune condition, overeating, excessive heavy or unhealthy meals, diabetes, lack of exercise is also a big contributor, and emotional and physical stress. There are many foods that can reduce inflammation and support a healthy cardiovascular system, such as garlic, rosemary, dandelion, wild salmon, which I love, all the other fatty fish, the omega-3, high in omega-3 fatty acids, all those are great for you as well. blueberries. I'm going to do a new video about this to put on my YouTube page, and this will be added too, but I'm going to do another one with more information because I'm kind of short for time. I have to meet with my girlfriend for Valentine's Day. So when it comes to the heart health, put these 5 foods and herbs into your diet whenever possible. Also, women tend to have lupus more often than men. And that is a known fact. Men can get it, but women tend to get it more because it's considered a woman's disease. And when vascular disease develops, or atherosclerosis, women tend to become symptomatic in the 3rd and 4th decade of their life. With me, I had my first heart attack. I was in my early 30s. And then again, 2 years ago. So it will frequently manifest with chest discomfort, sometimes pressure, shortness of breath, sweating, profound nausea, vomiting, diarrhea, or weakness. It is said that the so-called typical symptoms of severe chest pressure with radiation down the left arm is less common in women, making women less likely to seek early medical attention. And this happened to my sister because my sister also suffers from lupus and heart disease. Runs in the family. And what happened to her, she walked around literally for a week with angina pain and did not know it. And it caused her to have a lot of future problems that she is dealing with now that I'm trying to help her overcome as well. So the incidence of coronary artery disease in women with lupus is not known, but it's higher in women than it is in men. Of course, men who have lupus also can develop coronary artery disease at an accelerated rate, which is what happened to me. In my 30s, I had a heart attack, perfectly healthy. I used to dance, work out, everything. Well, I still dance and I still work out. But when I was younger, I was super, super, super healthy. And then I had this issue that occurred in my body. So with my first heart attack, I had pain. Not in the chest. I had it in my back. Not in the arm, but all my back was hurting and I was constantly tired. And then I had the heart attack. My second one, I had pain in the arm and I had, my jaw was numb. So that happened. So it can change. The first time you have a heart attack, and the second time, it could be totally different symptoms. But if you feel that there's something wrong and it may be deal with your heart, then you really need to seek some sort of medical help. So heart attack signs in women, like I said, when you think of heart attacks, we envision the numbness in the arm. This is a symptom that is most often seen in men, but may not be present in women. Like I said before, the first one I didn't feel it, the second one I did. So women with risk factors of heart disease may show signs that are very different, like chest pain, shortness of breath, stomach pain, jaw and neck pain, back pain like it happened to me, nausea, dizziness, lightheadedness. So the most common of cardiac involvement in lupus patients is pericarditis. The pericardium is a connective tissue that surrounds the heart and cushions it in the chest. When this becomes inflamed by lupus or other inflammatory diseases, it can cause chest pain. So pericarditis is usually not life-threatening like myocarditis, but can be quite painful. If you're recently diagnosed with lupus, you may confuse the pain of pericarditis with a heart attack. But always get yourself checked. Also, pleurisy can also make you feel that way. And but the pain of pleurisy gets worse if you take deep breaths. If you go and you feel that pain, that can also be pleurisy. Really, at the end of the day, it's better you go get yourself checked and make sure that it doesn't deal with the heart, because believe me, you don't want to go through that. So if you're suffering from lupus, you can develop chest pain. So you should seek medical attention immediately. This way the doctor can give you the right treatment for your issue. Oh, you're welcome, Pedro. So aspirin in high dose may be the first line of therapy, but other more powerful agents such as steroids may be necessary. Non-steroidal anti-inflammatory agents like ibuprofen are common. That's commonly prescribed. Pericarditis usually resolves with treatment, but may return. It may return again, after you've taken therapy for it, and you may have to get therapy for it again. It's very rare that surgery is necessary to remove the inflamed pericardium. Occasionally, excessive fluid may accumulate around the heart between the pericardium and the heart muscle. So this may lead to other problems. So a natural way to help reduce this is to avoid pro-inflammatory foods. Eat an anti-inflammatory diet. My diet is an anti-inflammatory diet. I also am gluten-free. I exercise. I do kickboxing, climbing, hiking. I work out with weights. I make sure I keep myself healthy. Especially now during COVID that we're home sitting down doing nothing. It's very important that we eat a healthy diet and that we exercise. Even if you're just taking a walk around the neighborhood, it's very important to exercise, keep at a certain weight. And if you notice that you're not doing that, try doing it. Even a simple walk after dinner will help you. Another disorder that you can get is valvular disorder. This is just as a connective tissue of the pericardium may become inflamed. So it too has valves inside the heart that can be affected. This is called valvular disorder, and is up to 50% of lupus patients have some valvular disorder involvement. But it is usually mild and it only happens to about 20% of lupus patients. And usually you can have complete resolution of the valve disorder involvement, but after a period of time, scarring can occur and results in damage to the valve. So this can cause leaking or improper blood flow inside of the heart. Ultimately, this can lead to excessive fluid accumulation and heart failure. So it's something you have to keep your eye on if you feel that this is going on with you. Occasionally, the heart muscle can become inflamed in lupus patients or someone who has an autoimmune condition, and this is called myocarditis, and that is chest pain similar to what occurs with pericarditis, or shortness of breath may occur. Once again, most patients have minimal symptoms, but in severe cases, the heart muscle becomes permanently damaged, and the heart can enlarge and the muscles may become weakened and flabby, leading to congestive heart failure. Medical treatment includes anti-inflammatory agents as well as specific therapy for heart failure when it occurs. Rarely does surgical treatment become necessary though. So I'm going to go over a few herbs that are good for heart health, and these will be good for anybody, not just if you have an autoimmune condition, if you're just a person who doesn't have an autoimmune condition. So the herbs are ginseng. It reduces cholesterol and has shown positive effects with blood vessel elasticity. Chinese angelica root, hey prima, is traditionally used to treat blockages and helps increase the blood flow. Sacred pine contains a potent antioxidant in its bark and needles and the nut that helps reduce inflammation in the blood vessels, lowering the risk of plaque buildup. Also, ginkgo increases capillary circulation and expands blood vessels. And the one that I make actually a tea of this, and I will post that. Actually, I think I have it on my website, YvetteLaboy.com. You can go there. Hawthorn berries tea, and the hawthorn berries reduce fat and mucus accumulation and purify the blood, and it improves blood flow. Recipes for hawthorn berries tea, it's on my website. It's not my recipe. I got it from my mentor, Andrea Beeman, but it's on my website. It's also on her website as well. So things that you can do. Hey, Francis, how are you? You can change your eating habits. Is the first thing, the simplest thing you can do. You can go from eating a nutritarian diet or plant-based diet. Even the Mediterranean diet is also a good diet. I started out with an anti-inflammatory diet. I also did the Mediterranean diet, and well, a lot of people are into keto. I'm not into a keto diet, but if that's what you want to try, you can try that. It's worked for many people. I try to eat, I eat now more of a seasonal diet. I eat what is healthy during the season because I feel that that's the way the body is naturally trained. For years and years throughout history, human beings have eaten what is healthy in their area. So that's the way I eat now, but I make sure that it's also anti-inflammatory because I can't have the extra inflammation in my body. It took me years to get healthy, and it took me years to become who I am today because I was very, very sick at one point in my life, and I almost died. So I thank God, knock on wood, that I'm okay. If you're a woman and you're on birth control, change your birth control pills because that carries with it a risk of blood clots. And if you smoke, again, need to stop it. A clot can lead to heart attacks. So ask your GYN about other forms of birth control. They have so many of them now. Also, get active. It is so important to get active. Burn calories each day with about 30 minutes of moderate activity. This is just to start, but getting a jump on your health can really help you from not becoming a statistic, you know? So there's no doubt that we need great quality food and daily exercise to support the health of our heart. And when it comes to the heart, this is also important, but not too many people talk about it. And I found this to be true with me as well with my sister. Sometimes our heart is much deeper than what we physically see. And you're probably thinking, well, Yvette, what the hell you mean by that? What I mean is that the heart is the motivator and the inspirer of the human spirit. And it is the emotional center of our human body. When our body, our spirit, and emotions are functioning at its best, well, there is a great sense of joy, love, compassion, and inner peace. It's possible that we could be holding on to anger at someone or something that happened to us in the past, our childhood traumas. Sometimes at work, someone you feel you're being treated unfairly, or you were hurt so deeply that we simply are afraid to open our heart and love someone for fear of being hurt. And I believe that with myself because for many years, and not too many people who know me know this, I suffered from anger issues. I mean, massive anger issues. And it was all connected to my heart, with a lot of things that happened to me in the past. So I had to work on that on a deeper level. I had to go into that deep, dark rabbit hole and work on that. And thank God that I was able to overcome that. And today I work with a lot of people who have lupus. I also work with people who want to lose weight. I also work with on gut issues as well, because I also had to repair my gut when I was sick. So these are the things I do, but I feel it is very important that we work on a deeper emotional and spiritual level and fix our traumas, because that not only can affect our health on a deeper level and our heart, but also our mental health as well. And I see that a lot now with what's going on. A lot of people have all these things that are starting to come out because we're at home, and now we could think, now we could take that look in the mirror and be like, oh my God, and deal with that. So if you need help with that, I highly recommend you go out and get help to heal those conditions, because you don't want them to turn into an illness in the future. I know a lot of people who suffer from cancer. Those are people who at one time, and I'm not saying everybody, has had a lot of anger, resentment, or things in their heart that they held on to, a lot of hurts. So let go of the hurts and the traumas. Sometimes we just need to forgive and let that go. So there are a lot of emotional scenarios that could literally hurt the heart on a deeper level and stop it from functioning. So sometimes we just need to go a little deeper, get to the truth, and get to the heart and spirit, and get it working properly on all levels, physical, emotional, and spiritual. So it is imperative to exercise our heart on many levels. That means all things that I mentioned above, and maybe forgive someone, or even forgive yourself for any past traumas or anything that has happened that you feel guilty or bad about or angry about. So, folks, this is all I have to share today. Thank you for joining me. I'm going to try to hop on tomorrow and talk about the heart chakra, because I also work with the chakras, and I feel that it's important. It's Heart Health Month, that we should be talking also about the heart chakra and how that affects our health on different levels. So I'm going to try to hop on sometime tomorrow. I'm not sure what time. It depends how my day goes, because I have a lot of things going on. I have clients and just a lot. But I'll try to hop on. So share this video with others who you feel may get something from it. And follow me here as Yvette LaBoy. Also on my business page, which is Yvette LaBoy, Lupus Wellness Coach. On YouTube, I'm Yvette LaBoy, Lupus Wellness Coach. Instagram, From Lupus to Living, and Coach Yvette LaBoy. Thank you for joining me today. I wish you all a very happy, healthy, and peaceful Valentine's Day. Mwah. Love you. God bless. And I look forward to seeing you guys again. Take care. Bye.